Can you hear me?
Yes po, Doc.
Okay. Is it loud and clear?
Yes po.
Okay. So I think the rest of the class can just come. Okay, since the participants is already around 91. Okay. So actually, this is a very short lecture regarding helminths. Um, I just emphasized here the most important, same as the previous organisms that we are tackling. So the most common that we encounter, okay, in the clinics and as well as in the hospital. So as we go on with our topic for this morning, supposed to be this afternoon, but I have a meeting, okay, in the hospital. So that's why I asked one of your coordinator, Elijah and Mr. Dennis, okay, to at least have time, earlier time, or if not available, probably next week. But since you have cancelled uh, subject, so I just inserted at least an hour or less. Okay, so with our topics. So before I start, okay, and uh, discuss to you our topics. So I just want to remind you guys that with regards to your exams yesterday, so I hope you're able to analyze the questions, especially in infectious diseases. So I know it's a bit tricky questions, okay, but I think when you know the topics or the topic very well, especially on my subject, then it would be easier for you to answer, and likely it will pull up your scores uh, if if my subject is actually easy for you. Okay, so I hope the succeeding quizzes, pa, okay. So you'll expect that we will give tricky questions. Okay, so from this topic on, okay, so probably you will listen and you try to review and get the most important uh, pearls, okay, on my topic. Okay, so this one, the one that I give you, my slides will uh, the slides that I've given you or the PowerPoints that I've given you. So please keep it on your batch. Okay, so do not uh, give it to other students. Okay, so just for your batch only. Okay, then probably on the exam itself, the final exam. So at least you have at least a copy of all the topics that I give you. Okay, so let's start. So our objectives, I just mentioned here the most common one, two, three, four, five. Okay, so of the helminthic infections, okay, we see in the clinics and in the community. So this is the usual pattern, okay, of parasitic infection, especially for helminthics. The one that they keep on the one that they keep on mentioning here is about the infective stage as well as the diagnostic stage. Okay, so remember from the ingestion. Okay, so from ingestion up to uh, having the diagnostic stage, which is actually the start until there will be a fertilized or unfertilized egg, the larval stage, the infective stage, etc. Okay. So we start with Trichinella spiralis. Okay. So actually, this one is common uh, in areas worldwide. Okay, so mentioned here siguro around 10,000 cases or more. Okay. So this is important, especially in countries who loves to consume meat. Okay, and then usually this parasitic infection is actually although it's mild, okay, asymptomatic. But if it is if the patient is immunocompromised, okay, and then doesn't treat the infection, then likely there will be unheavy infections that will happen. So they can be having diarrhea, severe diarrhea. Sometimes it will travel from areas in the body, like for example, in the periorbits, okay, the periorbital area, they have some edema, some myositis. But luckily, this is actually less likely to have death, okay, as an outcome. Okay, so from here, Trichinella, the larvae live in the muscle tissue of the animals, typically in pigs, wild boars, foxes, etc. Okay, so this is the life cycle of this helminth. Okay, so from this ingestion of undercooked meat, okay, from the domestic animal, okay, from the pigs, etc. Okay, so remember, if you trace its cycle, okay, so this larvae is released into the small intestine, and then this one they grow, okay, and then they are deposited in the mucosa, okay, until it goes into our circulation and will go into our muscle. We call it the encysted larva in the straightened muscle. Okay. So and this cycle goes on. So once the organism is already in our muscle, so we start to have signs and symptoms, body aches, some edema, okay, because this is foreign. So our body try to at least eliminate this foreign body, but actually this one, okay. So if it's not treated, uh, this will grow and then travel from other areas to the body. Okay. So once, for example, it goes to our intestines, so remember, a patient will have some diarrhea, frequent diarrhea, causing dehydration, and then sometimes may go vomiting, sometimes some swelling in the other areas of the body. So what do we need to know about this trichinosis? Okay, so remember from what stage, okay, where uh, the bit where the parasite infection is located, then that will be the time that the patient may have some symptoms. For example, its initial phase, the patient may complain of abdominal discomfort, some diarrhea, nausea, vomiting. Okay, so actually this is very fast. So sa upon the ingestion after 1 to 2 days, so you will have this initial phase. The second phase is where the encysted larvae already in the muscles. So that's why patients may complain of muscle aches, some symptoms of fever, chills, joint pains, etc. Okay, so remember it's worse. So it will actually go around 6 to 8 weeks okay, after the ingestion. So from travel from one area to another. Okay. So once it travels also okay to the larvae or the egg, okay, will travel to other areas. Okay. So in some areas, like for example, as I mentioned here, there will be some splinter hemorrhages. Okay. Uh, the nails, eyes, or some conjunctivitis. Okay. So that's why sometimes this one, the trichinosis infection, can develop around the eyes. Okay. In some areas may have some low-grade fever, abdominal cramps. Okay. So what I need to emphasize to you is the infective stage and diagnostic stage. Okay. So infective stage, this is the contaminated meat containing the encysted larvae. Okay. And then its diagnostic stage is the larvae encysted in the muscles. in human. Okay. So if it's too large, if the number of cysts are actually if the number of cysts is actually high, then probably can be fatal, especially if it's located in the heart muscle. Okay, so it suddenly will cause some severe chest pain, and sometimes once causes severe chest pain. Okay, so muscles here are exhausted, causing some arrhythmia. So the patient may die. Okay, so what do you think that we will do to diagnose this type of trichinosis infection? So they can be, since this is located in the muscle, then probably we can do some biopsies. Okay, so if we do some blood works, okay, we can see some eosinophilia, usually eosinophils. Because it's the muscles, they have some enzymes which are creatine phosphokinase. Okay, and then if we do some serologic tests, we can have some ELISA. Okay, and then we have what we call diarrheal stage. Okay, so we can just do some mechanisms where we can see some adults and larvae may be found in the disease. Okay. So what is the drug of choice? We can still give mebendazole. Okay. We can give some anti-inflammatory drug. Okay. And then if, for example, the patient is admitted due to dehydration, we can just hydrate the patient. We can give some if the patient doesn't want if the patient doesn't want to be hydrated with intravenous, we can just give some increased amount, okay, of oral rehydration solution. Okay, so so for the next one is for the nematodes general. Okay, so as you can see here, it's general features. Okay, so what are these? Okay. So what is important? Okay, this is cylindrical. Okay, they have pointed ends. Okay. So some anterior, the rounded anterior. Okay. So we have what we call the cuticle, as you can see there on the picture. Okay. So they have it's the digestive system. Okay, they have the mouth, esophagus. They have all the big gut. They have the anus. Okay. So this one, if they ask you, all are non-hermaphroditic or they have separate sexes. Okay, so same. Usually the females are larger. Okay, so what are the main features of the nematodes? Okay, so it's divided into two. We have the intestinal as well as the tissue nematode. Okay, so from its comparison behind, okay, so most of these diseases are diagnosed by identifying the characteristic eggs in the stool for the intestinal. Okay, so same with the tissue nematodes. Okay, so they demonstrate microfilariae. Okay, in the blood or some in tissue fluids. Okay, so take note of the difference. Okay, so what are the important medically nematodes? Okay, so from our parasitology subject, okay, so we have the intestinal nematodes, which are the Enterobius vermicularis. We have the Ascaris lubricoides, Spondyloides trichoralis. So we have the hookworms, okay, the Ancylostoma duodenale, Ligator americanus. Okay, so the one that I mentioned, okay, the Trichuris trichura and then the Trichinella spiralis. Okay. So we have the tissue nematodes, which are actually the lymphatic filariae. Okay, so we have the Wucher area, and then we have the lubia, which are the lubia malai. Okay. Or we have the cutaneous filariae, we have the Dapiculus melinensis, we have the loa loa, as well as the Octoserica volticulus. So as you can see here on the life cycle of the intestinal nematodes. Okay, so from here we have the water, food that is contaminated. Okay, so it is contaminated. So once it enters into the human, okay, so we have some larvae enters, and then from there they will produce some eggs. Okay, so from mature eggs, uh, they can be seen in the environment already. Okay, so this will be the life cycle of the intestinal nematodes. Okay, so it needs to be at least be familiar with this for the intestinal nematodes. Okay, so always the worm develops in the intestine, and the eggs are released into the feces of the environment, into the environment, and then this will be ingested, the mature eggs, and then likely, so it will develop the larvae, so its cycle goes on. Okay, so this will be the example of the intestinal nematodes. Okay, so we have the most common, the Ascaris lumbricoides. Okay, so we have the fertilized egg, and then we have the Enterobius vermicularis. We have the Vermicus vermicularis picture of the egg also. Okay, for the egg. So if you remember, if you see the microscope, especially the most common Ascaris lumbricoides, the Ascaris fertilized egg. So we can easily appreciate it in the microscope. Okay, comparing it with the Rhodus vermicularis egg. Okay, so so for the Ascaris lumbricoides, we have its general name, the scariasis or the roundworm. Okay, we have embryonated egg, ingestion of eggs into contaminated feces. Okay, so they can be located in the small intestine or in the lung. So there will be an eggs in the feces. Okay, so remember it's oval, brown with colorless shell, uh, containing very large fertilized and segmented ovum. If you compare it with the Rhodus vermicularis, this is the other name of this is the pinworm or the silkworm. Okay. So remember the effective stage, okay, embryonated egg. Okay, so same. What is the difference between the Ascaris as well as Enterobius? So autoinfection is common in Enterobius compared to Ascaris conditions. Okay, so its location usually in the large intestine. Okay. So Heterogeneous vermicularis, okay, this is usually in the perianal area. It can be located in the perianal area. However, this one, the eggs prefer less compared it with the Ascaris lumbricoides. Okay, so we start first with the Ascaris lumbricoides from its cycle. Okay, so from the ingestion, okay, uh, and then as you can see here from the unfertilized egg, until this will be fertilized. Okay, so as you can see here, what is the infective stage or the infective stage of this is the embryonated egg. Okay, what is the diagnostic stage is the presence of either fertilized or unfertilized egg. Okay, so from its life cycle, as we trace, okay, so from the embryonated egg containing the larvae, so there will be an ingestion of the embryonated eggs, okay, so containing the larvae. And then once it reaches hatch, okay, and then the larva will enter into the circulation. From circulation, from the intestine, okay, sometimes this one will travel into the lungs, okay, from the lungs and then to other areas. So that's why in some patients they cough out this what we call the ascaristomicoides. Sometimes it goes out to other areas of the body, like for the eye, okay, or sometimes in the feces. So uh, this will travel from one area to another. Okay. So if the patient has like this, okay, so I have a lot of patients already having this gastrostomy, especially if you are in remote places or if you have this what we call community. Okay, if for example, if you go to the community and then you do some tests for patients, okay, yung mga outreach programs, okay, so you expect a lot of patients to have aspiration of frequencies. Okay. So this is an example of ascaris lumbricoides. This is a roundworm. Okay, sometimes this one, when I was when I was a clerk in St. Louis University, so we have a case of actually ascaris lumbricoides in the intestine. Okay, so this is just an example. Okay, so this is a prominent uh, infection. Okay, so you can see the worms, the round worms. Okay, so just like spaghetti one. Okay, so this is common also in the exam. Okay, so they will show you the picture, especially if you're taking the medical technology course. Okay, so they will present you to draw, okay, and at least identify the parts. Okay, so but for us, as clinicians, okay, so just remember the life cycle, infective stage, and how to diagnose, okay, these kinds of worms. Okay, so this is the one for the Enterobus vermicularis. Okay, so from its diagnostic stage, so remember, okay, so X on the perianal folds. Okay, say, and then from there, from its embryonic stage, okay, the embryonated egg, which is our infective stage. Okay, so from there, it will produce, will go to the small intestine, the lumen of the cecum, etc., and then migrates. Okay, so this is the one that usually we do the scotch tape method. Okay, so as you can see here, usually it will lay eggs. Okay, on the very anal uh, uh, area. Okay, so you see they will hatch, then causing some chemicals that can cause some itching. Okay, so that's why, as you can see, patient usually scratch from the perianal area, okay, causing some redness. And then once usually they hatch during dawn, okay, sometimes they say around 6 o'clock in the morning, then the patient starts to scratch. Okay, so that's why one of the methods that we use is we do the scratch tape method, and then once they use the sketch tape method, they will just put in the specimen, okay, in the glass, okay, and then they will see in the microscope. Yes, you can, and then you will see already the picture of the organism or the worm. Okay. So from its difference, okay. So for let's start. We're first with the road use of patient may present with perianal pruritus. Okay, so sometimes they invade also the genital area, especially for females, causing from vaginitis, uh, sometimes pelvic or peritoneal granulomas. Okay. So, what do we usually give for Enterobius vermicularis? We can give some parental pamuwi. Comparing it with the Spanish lumbricoides, the one that is available in our community, there's some albendazole, we can give some albendazole, or some, we can also give parental pamuwi. Okay? So, aside from the other nematodes, okay, we have these intestinal nematodes. Okay, so this is the common life cycle. Okay, so it will enter from the broken skin or from the tissues, then it migrates to other areas, like for example in our intestine. They produce egg. From produced egg, they hatch in the environment, and the cycle goes on. Okay, so usually the most common, the most important uh, species or the organism that is involved are the hookworms. Okay, so we have the Ancylostoma duodenale, or they call it some old hookworm, or some Necator americanus, which is they call it New World hookworm. Okay, so this is a picture, typical picture of Ancylostoma duodenale. See the fangs. Okay, so this is common. So what is important for here is the infective stage again, which is the filariform larvae. Okay, so remember its transmission from the soil to the tissues. Okay, so this is common in farmers, common in areas where usually the individuals are fond of removing their shoes. Okay, so uh, they go to areas na usually uh, there's a high risk of transmission, okay, of the uh, bookworm infection. Okay, so what is important here is aside from infective stage, we have its diagnostic stage, which is the egg disease. Okay, so usually what is important for this hookworm, since usually has fangs, okay, is it will attach. Sometimes clinical findings of iron deficiency anemia, okay, which is prominent, causing some blood loss, okay, and then sometimes may cause some uh, cardiac problems, some local skin infections. Uh, Sometimes they have some respiratory symptoms because it can also travel from one area to another. Remember, it's sites of infection, okay, the small intestine, the heart, and the lung. Okay, so what is its laboratory diagnosis? Okay, so we can check in egg, okay, in the stool. Okay, so we can just do some simple uh, analysis, okay, at this time. Okay, so same. So what is good about parasitic infections? Okay, so some helminths. Okay, the medications are almost the same. Okay, so remember, we're giving some albendazole. The albendazole same as the one that we're giving for the roundworms or the Ascaris lumbricoides, etc. So this is the life cycle. Okay, so from each the larva that is hatched in the soil, it enters, okay, to the skin. Okay, so they migrate from one area. Okay, so sometimes they have some ground itch, which they enter the stream, blood circulation, and then sometimes they go to the lungs, causing some symptoms of coughing. Okay, and then sometimes once, for example, the larvae is swallowed, they say it go again to the intestines, etc., etc. So the cycle goes on. This is the life cycle of the bookworm. Okay, so as you can see that this is an example. Okay, so so if you see like this, okay, so you know what to give already. Okay, so if they ask you what will be the medication, sir or doctor, okay, so you can just give some albendazole, you can give some albendazole or pyrantel palmitate. So another one is the tissue nematodes. Okay, so remember, almost we say lymphatics, we have the Wuchereria bancrofti, and then for the cutaneous nematodes, we have the Dracunculus medinensis, we have the Loa Loa, and then we have the Ultracerca voltidus. Okay, so we start with the lymphatics, like this Wuchereria bancrofti. So uh, what to know about this Wuchereria bancrofti? Okay, so remember this is the elephantiasis. Okay, so this is one of the test questions that they usually give. Okay, so either they will ask you lymphatic filariasis or sometimes they will just call elephantiasis. Okay, so remember it's vector. Okay, the infective stage, which is the L3 larvae, and its diagnostic stage, which is the motile microfilariae. Okay, so remember since this one, okay, so remember its symptoms since uh, symptoms may travel from one area to another. Okay, so we have some information of the vessels. Okay, so sometimes because of its number, it can cause some obstruction already Okay, so that's why sometimes, as you can see, because of the obstruction, they start to have thickening, hypertrophy, some enlargement of the tissues. That's why the patient may have like elephant-sized leg, okay, especially in the extremities and sometimes in the genitalia. Okay, so this is the one that is important for you to remember. Its life cycle. So this slide was taken in the CDC site where you can see here from its vector to its human stages. Okay, so from the mosquito carrying the L3 larvae in the skin, and then we'll go to the lymphatics for the human stages. As we follow the cycle from one area, this is actually a very good slide. Okay, so until they have the microfilariae, the microfilariae until it migrates, and then the cycle goes on. Okay, so remember it's diagnostic stage, the microfilaria, and the infective stage, which is the M3 larvae. Okay, so this is an example, okay, of the vector. It's demonstration of microfilaria in blood. You can see here. Okay, so the picture of some elephantiasis. Okay, so what they usually do in terms of the obstruction, it cannot be reduced through medication. So we do some surgery, okay, for the elephantiasis, or sometimes you can give the diethyl carbamazine. Okay, so for the so aside from the uh, organism, okay, so we have the tissue or the filarial nematodes. So the most common here is the cutaneous uh, nematode, which is the loa loa. Okay. So what is loa loa? This is a common name for the ironworm. Okay. So from, if they ask you for the vector, it is rhizops or the ear fly or make fly. Okay. So since uh, the site of infection usually the subcutaneous areas. Okay, so from subcutaneous as well as the muscles. So they ask you what is the organism or what is the uh, nematode that is causing calabar swelling. So remember the lower lower. So calabar swelling meaning there's a swelling from other areas. Okay, so uh, sometimes since this one is an eye work, it was some angioedema, conjunctivitis. Okay, so some redness, irritation. Okay, sometimes it's just like some having some hemorrhages also in the eye. Okay, what you usually do. Okay, it can be demonstrated as microfilaria in the blood. Okay, so sometimes they do. You can see actually you can see in the uh, picture already. Or sometimes this one is some biopsies that they do. Okay, but the most common that we usually do is to check the microfilaria in the blood. Okay. So what is the treatment that we give? Okay, so we give the diethyl carbamazine. Okay, so for the microfilaria, and usually we give some lotions like swelling for the swelling. Like for example, we give some calamine, give some other types of soothing lotion. Okay. So this is also a picture showing to you the life cycle of the loa loa. Okay, so from its human stages. Okay, so I keep on mentioning is the infective as well as diagnostic stage. Okay, so from the L3 larvae, okay, so remember it's diagnostic stage, which is the microfilaria. Okay, so this is an example. Okay, an example of loa loa. So I think this is the last uh, topic already. because I discussed already the spirochete infection already. Okay. So I hope you, you were able to grasp, okay, our objective for this afternoon. This morning about the tissue nematodes, okay, the intestinal nematodes, okay, so the filarial worms, okay, uh, so and then the medications that we are giving is diagnostic stage. Okay, so uh, for this, okay, it's easier to understand. So if you want to go deeper, you can read the hard research, okay, about its life cycle, its medication, how it travels. But I think it's almost the same if you try to understand its pathophysiology as well as life cycles. It's easier to understand. Okay. So, are there any questions before we end our lecture for this morning? So, uh, I'll give again my slides so that you have a copy. Uh, so just keep it, okay, and then do not share to others. Okay. So I hope everything that I give you, okay, so you'll always use this one, especially with your review, especially in the game exam. Okay, so parang this is a summary, okay, of the IES pearls. Okay, so we can just add on. Okay, so if uh, I if I didn't tackle some, okay, the other infections, you can just run the pages in your Harrison, okay, and then just supplement. Okay, so but I think this is good for you already. Question. Actually, you see, if they ask you this question, okay, so just to revise your question, okay. So do we give prophylaxis for patients either going to some areas or not? Okay. If you are actually going to high risk areas or endemic areas, which are actually high, okay, high incidence, okay, sometimes there's some clinicians are giving some prophylaxis, okay, either uh, they start already just giving one capsule or just in 2 or 3 consecutive days, or sometimes just like prophylaxis for leptospirosis. Okay, but I think 1 or 2 doses already can be given already. So, for example, if you're ingested, if you're actually drowned and then some ingestion of the ova, for example, in an area, okay, which you do not know, okay, you can actually take, okay, some prophylaxis. Okay. Uh, if you're not sure, especially if you go to, for example, let's say you go to farming areas and you see you're not sure if you are safe, okay, if, if you are exposed to it, you can actually take some prophylaxis. Okay? But if you're confident enough, okay, you have the protection, so you can usually it's your idea already if you will take or not the prophylaxis. Okay, but usually I advise my patients, especially in high risk areas and high risk uh, to have this kind of infection. Okay, mga farmers, mga fishermen. Okay, usually this is common infection that we encounter. Okay, so are there other questions you want to ask? Okay, so actually some this topic uh, It's actually very easy to remember. Okay, so I don't think there will be difficulty if I ask you some questions about this type of infection. Okay, so later I'll try to check pala your scores. Okay, so you can just ask me. You can just message me if you want. If you want to know the scores. Okay. So I hope, okay, review well, okay, because you're going. Now it's already November, so your final exams will be coming soon already. So you can just review the topics not only in IPS but also from your previous subjects or from your current subjects already. Because it's difficult, especially in the final exam, because we actually get a lot of random questions. We give must know topics, okay, for you to understand before going to collection. Okay, especially probably on your area already. If they will ask you to go for face to face already, which is currently happening now, then probably uh, need to prepare. Okay? So mag-review na kayo, review so that you have a weapon once you go for face to face already. And for your preparation on your exam. Okay, so we want you to pass all your licensure examination, uh, and then you go on with your residency training already. So prepare first for the licensure examination. Okay, so the basics. Please remember always the basics. Okay. So are there any questions before we end this day? So if there's none, we can end the day. So I'll see you again next week. Okay, so if you have problems with regards to your subject, your topics in IDS, you can just approach me. Okay, wala na. Okay. Sige, have a good day and have your lunch.
Thank
It's
you po, Doc.
11:40 na. Okay, thank you so much.
Thank you, Doc.